Excellent. Pnawn da, good afternoon. Croeso nôl. Welcome back, everybody. I hope you really enjoyed the last session in the network fluid session. You were able to talk about those things that we discussed this morning and meet new friends and old acquaintances. Our afternoon session now, I'm really delighted that the new president of the Faculty of Public Health has been able to join us. Professor Kevin Fenton has given up some of his time this afternoon to be with us. Kevin's a senior public health expert and infectious disease epidemiologist who's worked in a variety of public health executive leadership roles across government and academia in the United Kingdom and internationally. I'm very happy to welcome him as our new president of the faculty as well, and we'll hand over the next half an hour to Kevin. Kevin, you're very welcome. Over to you.
Wonderful. Thank you, Andrew. And good afternoon, everyone. It's such a pleasure to be here with you today. I'm looking forward to both giving my brief presentation, but more importantly, hearing your questions and responding to some of your thoughts or reflections on both the day as well as what I will be presenting as well. As you are all aware, I started as the new president of the Faculty of Public Health in July of this year, taking over the reins from the wonderful Professor Maggie Ray. And I'll be in this role for the next 3 years. So as you can imagine, I've spent the first 100 days, which are not yet finished, meeting with a range of stakeholders, listening to our members, meeting with as many senior partners across the public health space, working with our specialist registrars and people who are training. And today I have a chance to speak to you as practitioners. So I'm really in that mode of listening and hearing what needs to be addressed, hearing your aspirations, and thinking about how we might work together between UKPHR and the Faculty of Public Health and continue to deepen the relationship moving forward. So I hope my slides are now projected. I don't have access to them, so I'm going to ask the slides for me so you'll be able to see them. And I'll be running through these. And then, as I say, look forward to your questions. But let me begin also by thanking you all for the work that you are doing and for your leadership and for your contributions over the past few years. The COVID-19 pandemic has been difficult on all of us. Every one of us has been affected by it, either personally or professionally in some shape or form. And even as we emerge from COVID-19 and we're grappling with new threats and challenges, now more than ever, we need to focus on the public health workforce, both on our training or capacity development and networking, but also on the well-being of our workforce. And as the faculty president, that's going to be one of my key priorities moving forward. So in the next slide, I just wanted to introduce myself very briefly. As I said, I've been the president since beginning of July this year. In the first 100 days, it's a structured program of key informant interviews with all the UK nations, all the regions in the country, all the chief medical officers or specialty registrars, speaking to people outside of public health and with the Royal Colleges as well. Workforce issues are coming up as a recurring theme for what I need to focus on as faculty president and the new board will focus on. And in fact, we had a fantastic strategy away day last Thursday, where we began to map out not only our strategic plan, which is currently in play, but new areas of focus and new areas where we'd like to bring new energy to the work of the faculty. So I look forward to sharing with some of those with you as well in the talk today. So in the next slide, we highlight the Faculty of Public Health strategy for 20 to 25. So we're right in the early stages of implementing this strategy. So as new president, it is not my priority to rewrite the Faculty of Public Health strategy, in part because many of the 8 areas of prioritization for us remain as important today as they were when the strategy was launched in 2020. And they are a focus on our membership and our workforce, ensuring that we remain true to our core USP, which is on standards, ensuring that through the work of our special interest groups and subcommittees, we continue to contribute to knowledge and advocacy, that our work is both here in the United Kingdom, but also globally. We now have 4,000 members in the faculty, and a significant proportion of them are overseas. And we want to ensure that we continue to promote not only high quality and high standards in public health training and development, but also that we think carefully about how we anchor global public health professions to us as an organization, and we learn from them and we support our partners working in different places in the world. We continue to ensure we have a strong organization, and our partnerships will be key to everything we do in the faculty. So these core elements of the strategy for the Faculty of Public Health remain unchanged. However, in the next slide, as the new president, I have been articulating new presidential priorities. So taking the strategy as it sits and all of the work going on in the strategy, where does Kevin place his energy over the next 3 years, and where does the board want to see real accelerated progress? So we move from the generalities of the strategy into real concrete areas that we would like to see change. And the next couple of slides will highlight some of those. So I began in the first day as president to say there are 5 areas which are really important to me. And these areas are important because I am a practitioner. I'm the regional public health director for London. I work with practitioners across the city and across the country on a day-to-day basis. And there are 5 things which I think are resonant with all of us. First, the commitment to ensuring that our workforce remains operating at the best of its standards, that we're resilient, that we're diverse and inclusive, and that we're fit not only for the present but for the future. Second, that we really think about our training and appraisal, revalidation, and continued professional development. I'm keen that we not only look at training and how we support our directors of public health, but I would like, by the end of my 3-year term, to think about how we support and work alongside public health practitioners, even before you decide to go into public health training, how we support you in training as you become a consultant or a senior practitioner, and then as you retire, how do we support you so you remain engaged, you learn, you continue to follow your passions in the specialty. That we will continue, 3, to have robust strategic partnerships which are impactful here in the UK and around the world. I've mentioned the importance of our global public health practice, and that we really focus on leadership. We often talk about public health has different pillars of practice: healthcare public health, health promotion, and health protection. I would like to see new pillars of practice which are equally valued. For example, systems leadership and health equity, which I think need to be brought to the table for the work that we do as practitioners today. So in the next slide, I speak about the importance of what we need to do as part of valuing our public health practitioners in this work, because the recurring theme will be how we ensure we have as robust and as inclusive a public health workforce. Now, I'm particularly excited about working with practitioners, and Andrew and I were having a conversation about this just before I joined, because practitioners are key members of the public health workforce, and I recognize you as such. The faculty does. We couldn't do the work that we need to do in place or nationally without practitioners being present, and so we want to build on that tradition that we have in public health of being a multidisciplinary specialty with medical and non-medical roots, and ensuring that we build upon the diversity that we have in our public health practitioners. But with that diversity comes some responsibilities. And these responsibilities include ensuring that there's transparency in the different pathways, that we have equity and parity in how practitioners are treated with other routes for specialization, and that we work together to ensure terms and conditions, the way we support each other, the way we learn together, are as integrated as possible moving forward. So again, I'm taking a more inclusive and large house, big tent approach to thinking about how we work with our practitioners, recognizing that practitioners fulfill vital roles across the public health system in all of the public health domains and work in a variety of settings. So just to underscore why me being here today is personally important, but also what I'm hoping to do in the years ahead. And in the next slide, I just wanted to highlight ways in which we will continue to work with UKPHR to advocate for the role of public health practitioners. We've joined together in many ways to call on directors of public health to both support local practitioner registration if no scheme exists locally, and to ensure that we're working with our directors of public health to have these in place. We want to work with local systems to support public health teams, including practitioners, to maintain their continuing professional development throughout their career from registration to retirement. So again, this concept of a life course approach to career development is key. And then third, to refer to UKPHR practitioner registration and FPH membership within job descriptions. So we have parity of professional esteem and professional opportunities for practitioners, whether you're UKPHR or FPH. So really thinking about how we harmonize those and how we work together wherever possible and feasible. That will be a key priority for me over the next 3 years. So that gives a sense, therefore, of just to start us off of who I am and why this work is important and why you are important for the challenges ahead. In the next slide, I wanted to just take us back to the nature of the challenges that we have ahead of us now and why I think this more integrated, holistic approach to the public health workforce is needed. One of the things some of you have heard me speak about before is that we have a moral responsibility to learn from the lessons of the COVID-19 pandemic and to ensure those lessons are converted into legacies in which we have enduring behavior and cultural change and new structures which allow us to build upon the best of the COVID-19 pandemic. And there are 5 areas here, which I'm not going to go through any detail today, but just to highlight that in thinking about this work, we need to think about how we continue to well-resource, multi-level and equity-focused public health systems. We cannot go back to a situation where we're denuding the public health capacity, workforce, and teams within place when we know that the challenges which we're being faced are even more. Partnerships will remain critical, both within public health, across the health and care system, and as COVID has taught us to move wider than the health and care system for partnerships for health. COVID has also taught us the importance of data, having high quality data available for us to ensure that we can characterize the problems, respond effectively, and evaluate our efforts. And I'm keen to ensure that we have more inclusive and robust data and metrics, which allow us to take a more holistic approach to understanding both the work that we're doing and its impact. And the final 2 lessons that I have taken away from the COVID pandemic are the importance of research, but research that matters to us as practitioners. So whether you call it translational or implementation or program research, as public health practitioners, we have to be more engaged in shaping the research agenda and holding researchers to account to ensuring that the research that they're providing makes a difference on the ground. And that's a key part of what I'm intending to do and I'm committed to doing moving forward. And then the 5th pillar, I think, of the lessons that I'm taking away from COVID are the importance of asset-based community approaches to health improvement, to tackling inequalities, to building trust and confidence in our services, and to have truly culturally competent programming, which I think is needed moving forward. In the next slide, then, we can look about how we apply these challenges, these lessons to the converging challenges that we face. And again, there are many challenges that we could call upon. I've highlighted 6 here, which I think are really critical and which are shaping where we are today. And these 6 things are really guiding the work that we'll be doing in the faculty to ensure we are both agile and we're responding to the threats that we have today. So very briefly, they include the changing epidemiology of infectious diseases, the emergence of new threats, and the ways in which we have learned from the COVID pandemic in terms of pandemic preparedness and response. We know that non-communicable diseases and the risk factors which drive them have taken a hit with the pandemic, and we're seeing both an increase in unhealthy behaviors, but the backlog on the NHS services means that the management of many of these NCDs has also taken a hit, and so therefore we need to get back on track in tackling that rising tide of NCDs. And for both infectious diseases and non-communicable diseases, health inequalities have been thrown into stark relief with the pandemic, and it's important for us now to think about how we are resolute in addressing them. At the same time, we need to be responsive to emergent threats, whether it's the cost of living crisis, the housing crisis, challenges with social cohesion, or the climate and ecological crises. These are the things which are defining how and where our practice will change over the next 3 to 5 years, and we need to be ready. I've already reflected on building upon the lessons of COVID-19 and my commitment to the workforce. So as I think about my time and tenure as president, these will undoubtedly be things that will guide what we will do. So in the final 2 slides then, how do we pull this together in what does it mean for us? In the next slide, for the strategy which we have identified 5 key areas where we're going to be having a constant drumbeat in the faculty, and we will work with our partners on these. These include our people, our partnerships, our policies, our programs, and our presence globally. 5 areas which are really, really critical for the work that we're doing. There's some immediate things that we've learned from the listening sessions that I've done in the first 100 days about where we can make immediate differences as a faculty. And they're highlighted on the right-hand side of the chart. And very briefly, they include things like, let's have a stronger focus on members' well-being. Let's really think about how we support our professionals through the post-COVID stresses and pressures that they're going through at the moment. Let's continue to work with our specialty registrars and ensure that we're bringing them in, and as well as young practitioners, and really harnessing the dynamic potential of our youth. Let's ensure that we have stronger local and regional presence for the faculty, partnering with our colleagues in ADPH, as well as in OHID and others, so that the value add that we bring to our local members can be clearly seen. And let's ensure that we are clear about career pathway development and the ways in which we train and support each other as we're going through that. And the final sort of cluster of things in points 8, 9, and 10 are around partnerships, strengthening relationships with allied public health professionals, Royal Colleges, and continuing our collaboration and advocacy. So these 10 areas are areas where you will begin to see the faculty not necessarily move differently, but with pace and deliberation. My penultimate slide then, just before we go to questions, really reflects on, I think, how you can get involved with the work of the faculty. And as I say, I'm committed to having a broad church in the faculty where we bring all the public health family together, and where we have emerging practitioners, for example, people working on population health management in the NHS, or colleagues who are working in sports and exercise medicine, or colleagues who are working in behavioral and social sciences, that we're able to think about how you get involved in the faculty, either as lay board members, being part of our special interest groups, being committee members, CPD advisors, or examiners. There's so many ways to get involved with the faculty. And in my final slide, it comes for me to say it would be amazing to strengthen and deepen the relationship with UKPHR over the next 3 years. I know both Andrew and I are committed to doing this, and I'm really looking forward to working with you all as we do and as we continue this journey together under what are, I think, really challenging times. So with that, Andrew, that's it for me. Thank you. Forward to the questions.
Thanks very much, Kevin, indeed, for sharing those words with us. And likewise, we too are committed to working with you, as you said, and thanks for your time today. I can see there's quite a few questions. So I'm not going to say anything else because you've been very good in giving us question time in your presentation. So let me just go down them in the list, first of all. I'll happily assist as well, Kevin, if needed, in relation to some of the ones that are directed towards UKPHR. So in what ways do we think pathways for practitioners might be being stymied in relation to registration from different routes?
I am asking that question as well, because as I've come into the role, what always amazes me is just how somewhat opaque or the lack of transparency in these pathways. And with a lack of transparency, it means that we're not clear about where the blocks exist and where the opportunities for us to improve may exist. So one of the things I've worked with the board on, and I've asked the board, is to really ensure that we're clear about what are the current pathways now that exist? How do we make them transparent? How do we work to support them so they end up with high quality support across those pathways? And that we continue to share and in a transparent way. We shouldn't have a sort of cloak and dagger approach to training in public health, right? We want to be open and transparent. If you and you need to understand the various pathways. So that's one of the things I'm keen to do. But I think it starts with being transparent and being honest about what the blocks are today. And I'm certainly getting that as I'm doing my listening sessions.
Lovely, thanks. And I'd just echo that by saying I think some of those questions are coming to us as well, and it's really important. We discussed this morning, Kevin, there's a lot of change in the system, a lot of new organizations, a lot of new people. So it's not taken for granted that people understand. So there's something there absolutely about open communication. So thank you. The second question is about our respective roles. There's some confusion apparently about the role of the faculty and UKPHR. So if I were to just say in the first instance, I'll let Kevin talk about the role of the professional body, and I'm happy to talk about the role of the regulator, which is what UKPHR is. So Kevin, can I just go to you first though?
Right. So the Faculty of Public Health is the faculty of the college that is involved in the training of public health practitioners, and also looks at standards of practice of those who are accredited public health practitioners. And we work to ensure that across the life course, through appraisal and your CPD and the support that you need, you continue to practice at a high level. Because we are a multidisciplinary specialty, medical specialty, it means that you can come into our path either as a medic or as a non-medic. And then there are ways in which you can become accredited as a public health practitioner with the public health Faculty of Public Health. But we recognize that there are other public health practitioners and other skill sets within public health that also have a pathway and that also need to be managed and supported as well. And for practitioners, for environmental health officers, many other professions. And so therefore we work with groups such as UKPHR to clarify those pathways, and where appropriate to look at how we support each other in the learning, in standards and in development moving forward. For medical trainees who are public health trained, then the regulator for them generally is the General Medical Council. And with that, Andrew, I'm going to hand over to you.
That's lovely. And I'll just give a brief description, but also a commitment. I'll work with Jessica to make sure that our role is very clear on our website, because I think that's part of the open communication you're talking about, Kevin. And I'll acknowledge, there are improvements in that area that we can make, and the changes that are happening, we need to really communicate clearly. So as Kevin said, we hold the regulatory role, which is the equivalent in relation to medical colleagues to the General Medical Council. We're the body, albeit voluntary, that makes the decision in relation to registration and revalidation, which means that we give you, if you like, that credibility with a trusted register, because we're subject to governance ourselves, that you have the necessary, or you meet the necessary skills that have been set by the professional body and comply with the standards, including things like CPD and annual professional appraisal that are required. So as regulator, we hold that role I think we're doing a number of other things as well, and we're in the process of openly discussing those, not least, Kevin, in revalidation. We are both the recommender, or the equivalent of the responsible officer, and the regulator. And I think we need a system conversation about that going forward. But let me commit with Kevin to make sure that we've got very clear sort of role descriptors of our respective organisations for all to read. The next question, Kevin, just with a couple of minutes left, is really important because it relates to communities and identifying, practitioners right at grassroots levels. So, what are your thoughts from the faculty about how you can support that very local activity?
Yeah, so part of it is just acknowledging that those practitioners are there, and that public health, by nature of what we do, has both the highly specialized professionals, but also you have a range of other professionals that are contributory and have a unique role to play. And the faculty doesn't have to be everything to all people, but what we need to do is to have our particular USP, because we know that you have the UKPHR, for example, we have the Royal Society of Public Health, you have the Association of Directors of Public Health. So we have different bodies within the public health family that will create spaces for different public health practitioners and workers to have their professional affinity, to connect with each other, and then to learn together as all of the bodies work together. So I completely recognize the grassroots work that's being done, and that's been essential in COVID. The question that then becomes important is, how are we connecting those grassroots practitioners, both to the organizations which support them, but the wider public, they feel part of that wider universe of practitioners.
Lovely, thanks. And just literally with 2 minutes left, I'm going to tie the last three questions together because they're so important, and they relate to diversity and inclusion, both within our own organisations and within the wider workforce. So in introducing that by saying UKPHR is treating that really seriously, we've had a board session and a full commitment in relation to diversity to inform our strategic planning this year. Kevin, we've got much more to talk about, you and I, in that space, but let me hand over the rest of the minutes for you to describe the faculty's approach.
Yeah, all right. So this is incredibly important to us. I think I'm the first Black president of the faculty, so that in itself is an accomplishment of sorts, and it's an important one. And for us as practitioners and the policy priorities for the faculty, we're going to be driving on climate change and climate justice. We're going to be driving on tackling health inequalities and a public health approach to addressing anti-racism, so that we really have a visible public health approach to that as being key, and helping people to live longer and healthier lives. Those are the big policy initiatives coming out from us. At the same time, we're looking at our internal procedures to ensure that we have that diversity, because in our regional membership, we need to ensure that it's representative. For our examinations, we're looking at them, and we have done audits to see how and where people of varied backgrounds, how they fare with our examination process, and to ensure that we're challenging ourselves equitably with HEE, Health Education England, on that pathway. So we have a very diverse input of people taking exams. We have a less diverse cohort of people who pass the exams, and we're challenging ourselves to see if we can improve that. So both in policy and in exams, and of course the people who work for the faculty and whose face you will see is changing. We're already recruiting our lay members, and again, we're encouraging much more diverse lay membership. And on my board, for this new board, it's among the most diverse boards that we've had. So, the key thing for me, Andrew, is walking the walk and talking the talk, and that everybody can see the difference that we'll make over the next 3 years. So I'm really glad we ended on that question. Thank you.
Yeah, thank you. And that's really helpful. And you and I will discuss that more, because we've got an equal commitment in both organisations to just say we do have a level of diversity in the board and the staff. We're really committed to continuing to develop that further. So, Kevin, I know you need to shoot off. Thank you so much for your time this afternoon. I'm just going to